Reiki 1 Lesson 10. Treating others with Reiki. Before you begin a full body treatment on another person, there are a few important things to remember. Never give a Reiki treatment to a person who has a pacemaker, as Reiki can alter its rhythm. Never give a Reiki treatment to a person who suffers from diabetes, mellitus, and are taking insulin injections, unless they're prepared to check their own insulin levels every day, as Reiki reduces the amount of insulin they require. Always explain to a person who is visiting you for the first time for a Reiki treatment exactly what you're going to do and the type of reactions that might occur. Stress that any one of these reactions are normal. They may experience one or two of these reactions, all of them or none of them. It makes no difference. Reiki will go wherever it is needed. The type of reactions that may occur are a sensation of heat, a sensation of cold. They may see colours. They may have past life flashes. They may have involuntary movements. They may even fall asleep. They may experience itchiness, emotional responses, rumbling stomach, memory flashes, pins and needles, and they may even sense your hands moving. Often the client will experience extreme cold at the position of your hands while you feel intense heat. If the client experiences nothing, explain to them that the Reiki energy often works on a subtle level, yet has profound results which normally become apparent in the following days or weeks. Never forget the client is drawing Reiki through you. They are doing the healing on a subconscious level. You are only the channel. Reiki will always travel to the place it is needed most. No knowledge of the human anatomy or physiology is required to work with Reiki. Leave your ego aside and Reiki will do the work. Forget the symptoms, treat the whole person. Listen to your client's body through your hands. Sense the different types of energy. If the energy is strong, keep your hands in that position until you sense a shift in the energy level. Remember, use your intuition. Look for non-verbal communication from your client's body. Deep sighs or hand and leg movements often indicate something positive is taking place. The normal time required for a full body treatment is between 60 to 90 minutes. At the end of a treatment, always offer your client a glass of water to aid grounding. Always wash your hands under cold running water after each treatment. Beginning the treatment. Ensure your client is lying flat on the therapy table with their arms down by their sides. Their legs should also be flat against the table and must not be crossed, as this may block the flow of Reiki. Gently lay your hands on your client's body. Keep them in each position for between 3 to 5 minutes. As you become more experienced, use your intuition. Your hands should be cupped with your fingers firmly closed as though you're trying to hold water. This keeps the channel strong between your client and the universal life force. If your fingers are open, Reiki can escape just as water would slip through your open fingers. In the case of burnt skin or a client's genitals and breast area, hold your hands just above the body. Don't forget the box of tissues. Full body treatment, hand positions. Remember, the following hand positions are only a guide. Use your intuition. Position 1. Cup your hands and gently rest them over your client's eyes, cheekbones and forehead, covering the third eye chakra. This position will help with stress, eye problems, asthma, head colds, allergies, sinuses, pituitary gland, pineal gland, and cerebral nerves. Position number 2. Place your hands on top of your client's head with palms covering the crown chakra. This position will help with migraine, headaches, eye problems, multiple sclerosis, stress, bladder, digestive disorders, flatulence, and emotional problems. Position number 3. Hands on either side of your client's head with palms covering their temples. This position will help with balance, tinnitus, hearing and ear problems, colds, flu, balances the functions of the right and left brain. To move from position 3 to position 4, gently move your client's head to one side and place one hand behind the back of the head. Then using the other hand, push the head to the other side and move the second hand behind the back of the head, as shown in the illustrations. Position 4. Move your hands to the back of your client's head, covering the occipital ridge. This position is good for headaches, eye problems, stress, hay fever, sinuses, digestive disorders, fear, phobias, shock, depression and stroke. To move from position 4 to position 5, repeat the earlier process of moving the head to one side, then remove one hand, then gently move the head to the other side and remove the second hand. Position 5. Place your hands along your client's jawbones, covering the throat chakra. This position will help with self-expression, communication, breathing, voice and speech problems, bronchitis, flu, colds and anger. Position number 6. Place your hands on your client's shoulders. This position will help with aches and pains in the arms, elbows and hands, tight shoulder muscles, stress, cold hands, disrupted blood supply to the arms and hands. Positions 7, 8, 9, 10, 11 and 12. Begin by forming a T covering the heart chakra and the collarbone. Then move your hands down and across the torso covering the solar plexus and sacral chakras. Form a V to cover the root chakra. Finally, place your hands over your client's knees and feet. These positions will help with all major organs and glands, disease, infections, stomach, intestines, reproductive system, anger, stress, emotions, leg pains and varicose veins. Once you've completed the front hand positions, ask your client to turn over. You may find that on occasions your clients have fallen asleep and you will need to gently wake them up. Positions 13, 14, 15, 16, 17, 18 and 19. Begin by placing your hands across your client's shoulder blades. Move your hands down as shown until you reach the base of the spine. Form a T as shown covering the root chakra. Finally, place your hands across the back of your client's knees and undersides of their feet. These positions will also help with all major organs and glands, disease, infections, stomach, intestines, back and spinal problems, reproductive system, anger, stress, emotions, leg pains and varicose veins. Treat all major organs and glands through the reflexology points on the feet. Finally, when all the positions have been treated, place your left hand on your client's crown chakra and your right hand on the base of their spine. This final position balances the energy in the client's body. Complete your treatment by combing your client's aura. Stroke the body firmly from the crown down to the feet in a sweeping motion. Continue past the feet until you touch the floor for grounding. Repeat for a second time, lightly touching the body, and then finally comb the aura a few inches above the body. This concludes Lesson 10. Please move on now to Lesson 11.